I just read that the president of Brazil has tested positive for the coronavirus and is taking hydroxychloroquine. I have a lot of questions because I know you have been in touch with Brazil and they have been in touch with you. First of all, I didn't see anywhere in the article that he's taking zinc.
So I'm trying to verify that. I know Bolsonaro is a fan of mine. He actually translated one of my YouTube videos and went on air in Brazil in April. And his family has been very closely following my social media. And I'm dealing with several major institutions in Brazil that have deployed my approach and with good results. So Bolsonaro is, I know for a fact, taking hydroxychloroquine and azithromycin. I'm trying to verify if he's taking zinc. So I don't want to speak without having that confirmed. But either way, he's doing really, really well. He actually took it on air to show the Brazilian public that it's safe. He's a real character. I like him, actually.
Well, if he does well, they'll just say, "Oh, most people who test positive do well." Correct?
Listen, I don't care what they say anymore. I'd rather speak directly to the American people and tell them, I have some very good news for you, American people and the people of the world. We have an answer to this terrible infection. We have a very effective way of treating it. We have a way that if you treat it properly, you have a 99.3% survival rate in high-risk patients and an 84% reduction in hospitalizations, which, if scaled globally, is the end of this pandemic. It's a $20 treatment regimen by mouth. If you stratify high-risk patients and begin treatment in the first 5 days with zinc, azithromycin, and hydroxychloroquine, you have a 99.3% survival rate in high-risk patients, 100% survival rate in low-risk patients, and an 84% reduction in hospitalization. What that means is end of pandemic. And that's the good news. People are not dying from COVID. They're dying from ineffectual political leadership. So we need to scream up and have a nonviolent revolution against the establishment who's creating barriers to access of care of life-saving medications because they want to bring down this president and because they want big pharmaceutical companies to make $3,200 a treatment of remdesivir instead of a $20 cheap generic drug treatment. So people are literally dying right now in the world, around 5,000 people a day, because of conflicted interests, political and financial. It's a crime against humanity. It's at the level of genocide.
Well, I happen to essentially agree with you, and I have been taking hydroxychloroquine just as a prophylactic. So,
me too.
You too. Okay. Well, you have a better reason. You're in contact with COVID patients more than I am, a lot more. Anyway, it's clearly safe. I get doctors who call me, and they're very angry. And one doctor told me that I was, we made a $1,000 bet on the issue, interestingly, and what will come out eventually with all the various tests. But he raised the issue, and he said, well, you tell me, Dennis Prager, one other time where zinc treats an illness. And I couldn't come up with any. So what would you answer?
Yeah, tell me one time where a bullet without a gun did anything. You know, you need a delivery system of the zinc into the place where it works. This person clearly doesn't understand medicine. Because I'm not saying, and I never said that take zinc and everything will be fine. What I said is take hydroxychloroquine with zinc and then everything will be fine. The reason why is you need to get the zinc into the cell where the virus is to kill it.
Yes, no, I get that. So, but what would you? But still, his question remains: where else in medicine is zinc a cure to something?
What does it matter where else? I actually don't know the answer to that, except for the fact I could tell you 40% of the adult population is zinc deficient, and it causes sensory neuropathies. It causes loss of smell and taste. So that's significant. But the point is, the zinc has anti-viral properties. It stops RNA-dependent RNA polymerase or replicase. It's the enzyme that makes the virus replicate itself. And if you block that mechanism, the virus cannot grow, and the immune system will then destroy the weakened enemy. So whatever his objections are, they're irrational. Because
so tell me why in your opinion, and I take their calls. You heard one once when you were on with me. Why are so many doctors? I mean, they just don't disagree on this. They are angry at me for advocating it.
Because they're stupid, and also they're on par of, let's say, you have a murderous dictatorship, and it has a military, and that military is given orders to commit crimes against humanity, and people follow orders blindly. That's on the same level of these types of people. They're not capable of critical thought. They're not capable of analysis. They just follow whatever the murderous governmental bodies that create false illusions, false narrative mandate, and they're afraid to take the risk to think more about the patient's well-being than themselves. That's why.
So, do you have any latest test?
I published a paper. It's available now on preprints.org. The process of being peer-reviewed. This paper is absolutely fundamental. I know it's on the president's desk. I know it's on Bibi Netanyahu's desk. I know Bolsonaro had it. I know that the president of Ukraine has it, and most likely Putin has it. And what the paper shows is if you use what's called the Zelenko Protocol, which I'll say again, risk stratify patients, identify the high-risk patients, treat them within the first 5 days of symptoms with zinc, azithromycin, and hydroxychloroquine, and what you get is an 84% reduction in hospitalization and a 99.3% survival rate in high-risk patients. And all these patients in the study had laboratory-proven COVID-19 diagnoses. It's a 100% study. That's the only study that has 100% of the patients studied that had 100% confirmed diagnoses. This is a statistically significant, rigorous, bulletproof, ironclad study done with the best researchers.
All right, where can people see it?
There's a website called the ZelenkoProtocol.com.
Okay.
ZelenkoProtocol.com.
All right, my friend. Thank you so much. And please tell Bolsonaro to take zinc.
I will.
Okay.